You can reduce the amount of time you spend on your aligner simulations by ensuring you submit the records in the right way. My name is Hisham. I'm a specialist and consultant orthodontist. I've been a dentist for 15 years and practicing orthodontics since 2013. I teach orthodontics to specialty trainees and to dentists, and I have a special interest in aligners. Now, when you're providing aligner treatment, the key step is really the online simulation and how you modify this. Earlier on, I spent a lot of time and many hours were wasted in not understanding how to communicate with the lab that you're using, and therefore I was getting lots and lots of different plans back and spending a lot of hours and evenings in trying to get the right one for me. So I wanted to discuss what the best way is to submit your first plan for any patient to try and optimize the plan that you get back as a step one plan. So when we are submitting the plan, the first thing I try and do is, when I'm looking inside the patient's mouth, is figure out any teeth that are in a nice position, and I'm going to tell the lab about any teeth that I don't really want to move very much. So this discussion really is focused on aligning teeth, straightening them. It's not really focused on the cases where we're trying to achieve a class 1 outcome and we're trying to fully camouflage. Not all patients want to have extensive treatment or want to have premolar extractions and want to achieve Andrew 6 keys. So this really is a discussion based around patients who simply want to have aligned teeth and how we submit their prescription for them. For that prescription, there might be some teeth which you don't really want to move, and there could be different reasons for that. For example, a lot of patients have the third molars erupted, but these are not teeth which we can move predictably with aligners or even put our fixed braces onto. Similarly, the posterior occlusion might be quite optimal, and the 7s and 6s might be well intercuspated. They may already be in a class 1 occlusion. So we need to identify very clearly for our technicians which teeth not to move. We also should identify for the technician that the teeth should still be covered by the aligner, as otherwise you'll get some eruption of these teeth and it could lead to an open bite developing later on down the line. So that's the first thing, is identify which teeth you don't want to move. And similarly, try to identify as well if there are any teeth on which you don't want to have any engagers or attachments placed. I often will try to avoid placing composite on teeth which have crowns because I know the bond strength is not as good. If it comes off repeatedly, then the patient has to come in for repeated appointments. So have a good look clinically and don't just go onto the online portal and forget about the clinical picture. You have to maybe refer to your photographs to remind yourself of the position of crowns, the position of any amalgam restorations which may affect your bonding surfaces. So have a good look at that to ensure you're not prescribing treatment or forgetting to prescribe approaches or aspects of your treatment which could be quite important. Once you've done that, we start looking at the different relationships that we are trying to correct or not correct. What I mean by that is, are we going to accept the incisor relationship at the end of treatment or not? And if we're not going to accept it and we want to correct it, then we have to provide the technician with specific instructions on how to do that. For example, if we're extracting upper premolars, we will say something along the lines of, please correct the incisor relationship by extracting the upper first premolars and retracting the upper incisors. Without this specific instruction, we can't request an overjet correction. There's no point in just writing, please finish the case with an overjet of 3 millimeters, because unless you prescribe the mechanics to achieve that, the technician will provide you with a plan which doesn't work. So be very specific in the type of movements you're prescribing and what you're trying to achieve. Conversely, you might be trying to accept the incisor relationship. So be specific and say, simply align the teeth, resolve the crowding with IPR, but we accept that the overjet is going to be increased at the end of treatment. Just make sure it's not worse than it currently is. And you can ask for that in a specific request. There's nothing wrong with accepting that some parts of the treatment are not going to be optimized because the patient doesn't really want to spend the time, money, or the effort of going through more comprehensive orthodontics. Similarly, when we're talking about overbite, we need to try and identify for the technician how we're going to correct this vertical relationship. Now, most cases tend to have an increased overbite rather than a reduced overbite or anterior open bite. And so most of the overbite correction that we achieve with aligners specifically tends to be a relative correction. So it tends to be achieved by some incisor inclination changes and sometimes by getting some posterior extrusion as well. It's not really true incisor intrusion that we're achieving. So It's important to figure out in your case what is the method of overbite correction and try to define that in a clear way. Try to explicate this to your technician by writing a sentence about overbite correction. Something, for example, along the lines of correct the overbite by avoiding any extrusion of the posterior teeth and by allowing the lower incisors to procline and intrude by 2 millimeters, or whatever the measurement happens to be in your case. By giving really clear and specific instructions, the technician will know exactly what you're trying to achieve. Now, they're not always going to come back with the perfect plan, but it's going to be closer to what you're asking for by giving as much detailed information as possible. With regards to attachment design, that's something I tend to focus on a little bit later on. And the reason for that is, from the first plan, what I'm really trying to get is an understanding of how can I align these teeth, what is the final resting position of the teeth, what does the arch form look like, and those are the instructions that I'm trying to give to my technician. I'm not really interested right now in the staging of the treatment. I'm not particularly interested in the attachment design or anything else. I just want to look at the final outcome and where the teeth are going to be positioned. Once I'm happy with that, I will then, in later reviews of my plan, look to harness and harmonize the overcorrections, the attachments, the buttons, and the staging. Right now, as I said, we're just looking to finalize the tooth positions, and the treatment delivery will be considered in more detail in subsequent reviews of that simulation. So I hope you found this helpful, and I'll see you next time.